Welcome to our 111 talk with Professor Shirish Prayag, who is the Director of Critical Care Medicine at the Prayag Hospital Shree Medical Foundation. And he is as well a proud editorial board member with the ICU Management Practice platform. Now, Professor Prayag, what is the current state of COVID-19 in India?
Well, thank you, Christian, for having me this evening. The current status is really devastating. We are facing a tsunami, not just a wave of patients, but a tsunami really. We are seeing a very large number of patients, and a large number of them are probably getting serious and requiring hospitalization with oxygenation and mechanical ventilation as well. So it's a huge problem. It's a huge problem in India right now. The extent is variable in various states. From where I come from, which is the state of Maharashtra, which is on the western coast of India. I live in a city which is about 150 kilometers from Mumbai, which is the central hub of the economic capital of India. And we ourselves are facing at least 10 to 15,000 patients happening per day in the city alone. A large number of them are requiring hospitalization.
Why do you think there was such a sudden increase in the number of cases?
Well, I think we knew that there was a likelihood of the second wave, which the whole world was predicting. But I think overall, the public became a little lax about the fact that in the Western world, the second wave came towards the end of the winter in the months of December and January. And we thought, perhaps the general public thought that perhaps we have beaten the second wave. We didn't get it, not realizing that in India, the first wave also occurred about 3 or 4 months after what happened in Europe and in the United States. So without realizing that, we thought that we had overcome, and a large population became a little lax. Also added to the fact was that there was an economic disaster in the first lockdown, which happened between March 2020 to about June 2020. And so when things were a bit relaxed, everyone started to go back to their original activity. There were lots of weddings, there were religious festivals, there were elections, there were meetings, there were get-togethers, there was travel. And it sort of all came together to have this kind of a huge wave.
What do you foresee happening in the next few weeks? And do you believe do you think, can this be controlled? And if yes, how?
The only way to control, as the world has known, is to have stricter lockdowns. We have had a significant lockdown kind of situations over the last few weeks, but epidemiologists have always told us that lockdown is not the way to control. It has its own shape of the curve, and over a period of time, as social distancing increases and as the herd immunity builds up, the number of cases are expected to fall down. One other reason which I forgot to mention, as the number of cases being so high, was the laxity in vaccination program, which happened between the months of January and March. I think we were taking it a bit too easy rather than forcing it very aggressively. So I see over a period of time, the number of cases will take its own shape of the curve. Today, hopefully it is at its peak. It's 400,000 cases a day across the country. And mind you, this is likely to be an inaccurate number. The reason why I'm saying that is that a large population is still not have the access to get RT-PCR testing, which is the way to be counted to. So presumptive cases are not counted unless they are properly tested. A large population is not doesn't have the facility to have RT-PCRs. Number two, the number of deaths also have got to be registered online, and a large population is still doesn't have the regular clear access to the internet and the facilities thereof. And therefore, I suspect that the number is not at the 400,000 or the 3,500 deaths which are officially quoted. It might be much larger than what we are seeing, what we are projecting. Anyway, it's expected to go on for a few weeks more because just couple of states, 5 states to be exact, have just gone through processes of elections, and large gatherings have taken place, and we know that about 3 or 4 weeks down the line, we start seeing a larger number of cases. So I wouldn't be surprised if those states show a larger number of cases in the coming 3 to 4 weeks.
If at all, who is responsible for this disaster?
I don't know. I think it's the population at large who have been a little indisciplined, who have not taken the warnings which have been given to them at length all the times. And I think we all as a general population need to be accountable. I don't think there is any particular person or particular organization where we can point fingers. We all have to point our fingers to ourselves, saying that we as a nation have not done the job rightly, and therefore we are facing this calamity.
What role could the government have played in preventing this level of devastation?
Well, I think the government could have been more proactive in managing the vaccination drives. For example, the vaccination rolled out in January, mid-January, we started vaccinating. There were lots of myths around vaccination, so it took off very, very gradually, and it was only available for healthcare professionals at that time. It's only at the beginning of March that it started becoming available for 45 plus with comorbidities, and early April that it became available for 45 plus. I think this could have been much more intense, and they could have reached many more towns and cities in a huger way than what they have done right now. I know a large number of countries in the Western world have also been slow in vaccinating people, but I think India could have done better. India could have also ordered the number of vaccine doses in a much larger number, could have procured them much faster, because we are a giant hub of production of these vaccines. So we could have incentivized those pharmaceutical industries to actually manufacture a large number of dosage. And if this could have been managed better, we could have been little better off. Secondly, our preparations haven't been adequate to the number of patients that we are facing. So the oxygen crunch that the whole world is talking about, the lack of number of beds that the whole world is talking about, that could have been anticipated in a little better fashion. We thought we knew that there could be a second wave, but we never prepared ourselves for this large a number. So even today, we are struggling for these resources.
How do the Indian people feel? Because you mentioned it before, India is the largest producer of vaccines, and only a small fraction of the vaccines are actually staying in the country. Everything gets exported. And when you see there have been some drastic measures within the European Union where they said we do not allow to export these vaccines any longer to any other country before we have vaccinated our people. Now, what is your stand on this?
I feel, as a personally, I feel that we should have managed the stocks of vaccines much better than what we have done ourselves. I think there's no harm in saying that we reserve it for our own country to begin with, rather than allowing exports or trying to help other nations. It's a magnanimous move to give it off to smaller countries which do not have access. It's a great move politically, but I'm not sure whether it should have been at the cost of our own population. I personally feel that we should have managed our vaccination drive much better.
Now, we see everywhere these big problems that hospitals have shortage of all resources, and in particular oxygen. We have seen that a couple of companies and several states are flying in supplies in order to help. Where is this helping, or where is the outlook on this?
Well, we are still short of oxygen, especially in the smaller towns. The reach of the oxygen could be better, much better. There have been situations, even in my own city, which has a population of 5 million people, by the way, wherein hospitals have run short of oxygen supply at a very short notice. Even in the hospital which I am managing and the ICU that we are running, there have been instances where we had to shift our patients on ventilator through ICU ambulances to another center, just because there is a potential for oxygen shortage coming up in a few hours' time. And that's the worst case scenario which can happen to any hospital. And these nightmares have been recurrent, really, in a large number of hospitals, in a large number of cities and in town centers. Only very big hospitals which have their own oxygen production capacities and tanks can have handled them well. But India is a country which is dependent for 80% of their healthcare delivery is a private healthcare delivery. And amongst these 80%, only a small fraction is really controlled by the gigantic, big corporate hospitals. A large portion of the healthcare delivery comes from smaller setups, 50 beds, 30 beds, 100 beds, those kind of setups. And they are numerous. And that's what the country is dependent on. And these are the guys who are suffering from the oxygen shortages, because they're entirely dependent on supply from outside agencies.
If you could reach out to the Indian Minister of Health and demand something from him and give him some advice, what would you tell him?
I think, I don't know. I mean, to say the least, we could say that we need to ramp up this oxygen issue much faster than what we are doing. They're doing everything. We are told that they're trying to do everything. For example, in my city, yesterday, there was a hospital which was going to run short of oxygen in 4 hours' time. They just called the police, and the police ramped it up by getting oxygen cylinders from other hospitals, which eventually then ran short of oxygen. Then they went and got help from some suppliers of oxygen. So my first take on contacting the health minister would be to prioritize the oxygen delivery on a war footing. I think the military needs to come in if required and make sure that the tankers of oxygen are flowing smoothly. The industrial oxygen consumption and utilization has been stopped completely, but we need to open up those facilities which have oxygen generating abilities and just ramp up and start faster deliveries. Ventilators is another crucial issue, but then that doesn't have an immediate solution, does it?
How much do you think will this devastating crisis change the Indian health system for now and for the future?
It is understood that it will be a disaster. I hope it changes for the future. I'm not sure whether how much we'll learn our lessons from this debacle, from this devastation, from this disaster, from this great human tragedy. I hope we do learn. But again, because the system is so dependent on private healthcare players, it finally leads to the mindset of those who are actually running the industry. It's a little disjointed, unorganized healthcare sector. The government does not participates in the healthcare delivery to a 20% extent, and that too at a lower category, not the higher category, which means that the higher end healthcare is unfortunately not available in a very free manner. The private healthcare industry, finally, it then is left to the private healthcare industry to have its own top-end officials to decide on the policies, to learn the lessons and to change themselves. There is unfortunately not a centralized audit for the healthcare industry in the private. The audits are left entirely to the leaders of the organization. There is no system like a JACO in USA where they will be audited for their performances and then given licenses.
Okay, thank you so much.
I think
it was very, very insightful, and thank you for your very honest and open way of explaining to our large audience what's going on in India. Let us assure you that all the world is looking at India. We think about you, and we hope that actually you will overcome this crisis and at the end emerge much stronger than one could expect.
Thank you, Christian. It has been a pleasure on this evening.
Thank you very much indeed.